trauma and may be accompanied by severe pain, splinting, difficulty breathing, and hypoxia. Mortality from rib fractures increases with the number of rib fractures, extremes of age, either very young or very old, and with the presence of underlying illnesses such as COPD or heart disease. Signs of rib fractures may include pain with palpation, chest wall contusions, crepitus, shallow respirations due to pain. It's important to remember that lower right rib fractures may be accompanied by a liver injury, and a lower left rib fracture may be accompanied by a splenic injury. A flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places. Flail chest is a serious injury because there is often an underlying lung injury, often known as a pulmonary contusion. Flail chest injuries are commonly seen with falls, motor vehicle accidents, industrial injuries. The defect in the chest wall seen with the flail chest will cause paradoxical chest wall motion as the patient is breathing.
Hi everyone, I'm Nicole Levine with this month's edition of Documentation Minute. Blunt chest trauma patients can decompensate quickly, particularly if the underlying injury involves the heart, lungs, or great vessels. Your attention to detail and documentation of that detail will serve both you and your patient well. Are there any obvious or less than obvious chest wall contusions, wounds, or defects in the chest wall? What does the patient's upper back look like? Was it fully exposed? Is there any crepitus or subcutaneous emphysema, pain with inspiration, tenderness to palpation? How are the lung sounds? Are they symmetric, decreased, or absent? Now, if something fell on top of the patient, describe it. Approximately how much did it weigh and where on the victim did it land? How did you find the victim? Your thoroughness in assessing the patient's clinical signs and symptoms and documenting these findings and then painting a picture of your patient's condition to the hospital staff will prove very beneficial and possibly even life-saving. Thanks so much for joining me with this month's edition of Documentation Minute.
What happened to our patient? Our patient had a right-sided tension pneumothorax, 2 right-sided rib fractures, a large pulmonary contusion on the right side, and a right-sided clavicular fracture. He was treated at the receiving trauma center with a right-sided chest tube, followed by a 7-day stay in the trauma ICU before being discharged home. The key to success in this case was that the lead paramedic identified that the patient had a tension pneumothorax as soon as it developed, and he treated it before the patient decompensated.
At times, the traumatic blunt chest trauma patient could present stable but suddenly take a turn for the worse and may require aggressive airway management. So in a preparation stage, have your intubation kit ready, have your bag valve mask ready, and set ready for action in the event the patient takes a turn for the worse and you must aggressively manage the airway.
Okay, lung sounds are gone on the right now. I believe we've got a tension going on. Dan, can you set me up for a needle decompression?
Remember, when assessing the blunt chest trauma patient, these patients are notorious for decompensating. The patient that seems completely stable on your arrival may be requiring intubation due to respiratory failure before you even get to the hospital. The patient you evaluate with no apparent injuries may have a simple pneumothorax with no apparent signs or symptoms. This small asymptomatic pneumothorax can easily become a tension pneumothorax several minutes later, and you don't want to be caught off guard. Be prepared. Treat these patients with the care and caution they deserve. Evaluating these patients frequently with documentation of these frequent reevaluations is extremely important. A helpful tip is to trend your patient's vital signs. A respiratory rate that is slowly climbing may be a warning sign that something more serious is brewing. How is the patient's oxygen saturation? Is the O2 sat holding steady or is it slowly dropping? Your thoroughness in your history-taking skills, physical exam skills, and attention to detail with frequent reevaluations and documentation of those frequent reevaluations are of paramount importance. It has been an honor to feature the professional